Do you have a friend or relative with sleep apnea? More than 1/4 of adults have sleep apnea. This sleep disorder occurs when the airway becomes blocked by the tongue during sleep. The obstruction of the airway limits the airflow down to the lungs. This causes oxygen deprivation and a lower quality of sleep. This leads to daytime fatigue and impaired cognitive function, along with heart disease and hypertension. There is a need for a solution to sleep apnea that is affordable, completely opens the airway, convenient to use, and does not restrict patient movement or sleeping position during the night. There are no devices on the market that meet all of these requirements. The closest method is to surgically implant electrodes. This is very expensive. There is a need to stimulate the tongue without using surgery. Roughly 1 billion people worldwide suffer from sleep apnea and are potential customers for our product. Our patented design is unique in that it is completely non-invasive and delivers timed electrical stimulation to the tongue. This unblocks the patient's airway. It is essentially a night guard that controls the patient's tongue, moving the tongue so that it is not blocking the airway every time the airway becomes blocked. For patient safety, we have two methods of detecting sleep apnea: an airflow sensor and a backup oxygen sensor. Each of these will trigger stimulation. Our device will sell for around $1,000. Manufacturing the device is estimated to cost $200, including materials and labor. We will outsource the manufacturing of our device in order to decrease costs. Every device will then be tested to a high standard before distribution. A marketing team will be used to teach doctors about the benefits of our product. These doctors will then be able to prescribe the device to their patients. We are looking for investors to fund the design, testing, and manufacturing phases of our product. In addition, we are looking to partner with a medical sensor manufacturer to supply the parts for our product. The major competition for our device is CPAP and surgery. CPAP is inexpensive, but it is a very cumbersome device that covers the mouth and nose and works by mechanically forcing air down the patient's throat and into their lungs. As you can imagine, this is not very comfortable for the patient. The leading surgery approach is Inspire therapy. This involves surgically implanting a small device that uses electrical stimulation to open the airway. The drawback of Inspire therapy is that it is more than $40,000 and requires highly invasive surgery to implant the device. On top of that, it is an additional $20,000 surgery every 10 years to replace the battery. Our device fills all the needs I presented. Most importantly, it is affordable and will be a fraction of the cost of the Inspire device, 1/40th. The entire design fits in the patient's oral cavity, unlike CPAP that has a tube leaving the patient's mouth. This allows our device to be significantly more portable and more convenient. Additionally, our device will allow the patient the freedom to sleep in any position, unlike CPAP, which requires the patient to sleep on their back. Our potential partners will benefit by having a reliable customer, as there is a large and continually expanding market. We have created and tested prototypes that will non-invasively stimulate the genioglossus muscle in the tongue. We have tested to minimize the voltage used while effectively opening the airway. The first round of tests were performed on myself using video capture to analyze the airway. We then have a sleep study scheduled for early C-term, where we will have a sleep apnea patient use our device for one night. They will be monitored the entire time, and the effectiveness of our design will be proven. We are moving forward on our project effectively, and only ask that you let all of your friends and relatives with sleep apnea know to be on the lookout for our life-changing device. Thank you.